All right, I see more people trickling in. We are right at the top of the hour. Thank you all for joining. My name is Gabriella with EMI Advisors. We welcome you to today's work group kickoff. Please feel free to say hello in the chat and tell us where you're joining from. That we greatly appreciate it, your organization. Great. Okay, we'll get started. I want to ensure that we have our core team members on, and we do. Okay, so we're officially kicking off. Again, thank you all. Good afternoon. My name is Gabriella, and I will be supporting today's call with controlling the slides and announcing our amazing presenters for the day. To get us oriented, just with some housekeeping, we want to thank you for joining the CDC Social Determinants of Health Public Health Use Case Work Group for Chronic Disease Prevention. Today is our official kickoff. Please know that due to the large number of attendees, we have muted everyone upon entry. Please be mindful of your background noise. We know that we all live in different places, so we just want to be mindful of that background noise. We will be controlling some of the features on our end, so we hear any noise, we'll try to minimize it. You are encouraged to use the Zoom chat function as well as the reactions. There is a raise hand featured if you would like to speak or ask questions live. We encourage that participation. And please, when you do send a message via the chat, friendly reminder to send it to everyone. Since I'll be displaying the slides, if there are any technical difficulties, you can contact my colleague Savannah, who's supporting us in the background to ensure that you have the proper access. And I just share that in the chat. If you have not done so, please, we welcome you to officially join the work group via the HL7 Confluence site under the Gravity project. It will take you directly into how to join. It is a sign up form. If you want to check whether you have already signed up or if others from your organization have, there is a feature at the bottom of the form that showcases everyone that has joined the work group. For all work group information, you can contact myself, Gabriella, colleague Savannah, and our CDC point of contact is Kyla Davis, who's also on the line. Here is today's agenda. We'll start with some introductions, opening remarks, a background, orientation of the work group, dive a little more into the current problem at hand, and then review some work group materials with you and discuss next steps. All right, just starting introductions, I would like to call on Tim, if you don't mind kicking us off.
Yes, good afternoon, everybody, and thanks so much for joining us. I wanted to take a moment to first acknowledge Dr. Karen Hacker, who's on the call with us today and will be providing us with some opening remarks in a moment. But I think in setting the stage, before I introduce the team to you, it would be helpful to understand that upon Dr. Hacker's arrival into the center, she obviously felt that social determinants, health equity, and health disparities was something that we needed to put in the forefront. And she challenged the center to rethink about ways that we could do chronic disease prevention and health promotion, build strong connections to communities, and then advance our strategy around social determinants and health equity to inform a more comprehensive approach to those things. The team that we assembled to help us to think through those things, at least from the data strategy perspective, is the next slide, please. Myself, Tim Carney, I'm the Associate Director for Informatics in the National Center for Chronic Disease. Dr. Jennifer Wiltz is our Deputy Medical Director and serves as the Chief Scientist on this Gravity work that we're doing with EMI Advisors. Dr. Pam Pagano serves as the Contract Core on this effort. Dr. Kyla Davis is our Chief Technologist on the effort, and her, along with Dr. Pradeep Padilla, serve on the Gravity Technical Advisory Committee. Dr. Jenna DeCruz recently joined our OIIRM office as a health scientist, and Rashawn Jones works in helping us to do some of the messaging and communication on the effort. Next slide, over to you again.
Thank you very much for the welcome. And just as a formality, we want to ensure that you get to know EMI advisors a little bit more as well. Our vision is to optimize understanding and use of health policy and health information technology in support of better, safer, smarter, and affordable care. It is truly an honor to support the efforts of CDC and by the guidance of the wonderful leadership that Tim just mentioned. From our end, this is our project team. I'm Gabriela Gonzalez. I serve as a project manager. We do have on the line Evelyn Gallego and three amazing subject matter experts, Kate Gifford, Shito Shaw, Amy Zimmerman, and Savannah Mueller is supporting the work as a project analyst. And we want to take an opportunity to get to know our virtual audience a little bit better. We know that we are spread in many different areas geographically, just to get a sense of where you're joining us from. If you don't mind responding to a poll that it will be launched now. You'll get to see a few options, really looking into the census regions and divisions. We'll have the poll up for about 60 seconds. And we encourage you to share your location with us. I'll monitor that for a second here. And we also encourage you, if you would like to say hello via the chat, please let us know the organization that you're joining from. It'll be great to hear from you.
I did.
Perfect. Can you check it out?
Just double checking to any background noise. Thank you. All right, very close to closing the poll here. If you haven't had a chance to answer, please let us know where you're joining us from. Wonderful. So let me end the poll and share the results. Is everyone able to see it? Okay, it looks that the majority of our audience is joining us from the southern United States. About 45% of attendees are in the South. And then we have the next top answer as the Northeast. I'm joining from New Jersey, so definitely part of that Northeast group. Well, thank you so much for letting us know where you're joining from. And without further ado, I would love to pass the mic over to Dr. Karen Hacker for opening remarks.
Thanks so much, Gabriela. Plus, you have such a great voice for facilitating. Thank you. So first of all, I just want to welcome everyone to today's conversation. As Tim said, social determinants of health are quite important to us here in the National Center for Chronic Disease Prevention and Health Promotion. When we talk about social determinants, though, we're not necessarily talking about the individual needs that might be identified. And a lot of work obviously is going on in this world right now about screening individual patients, individual folks for social determinants, or what we're saying are health-related social needs. But we're also interested in what's going on in communities overall. What helps to make communities resilient? What are some of those things that didn't seem to be present during this pandemic and that led to an exacerbation of the existing health inequities? And what can public health learn from this? What's the role that public health really plays? So for those of you on the call who are in the public health realm, because I know we have lots of folks from all areas of health and healthcare, but for those of you who've been in the public health world, particularly at the local level, you probably know that what often happens is that data starts to come in the healthcare realm, and public health does not have access to that data. And in order to get access to that data, they've got to build those relationships, knock on the doors, but they're not always answered. So as we began to see this unfold and began to see that there was going to be some screening going on for these social needs within the healthcare system, and obviously the data that's being collected in electronic health records, we felt that it was important to be at the table and to be developing the public health use cases about how this information on social determinants of health, on social needs, could be interpreted by public health, used by public health for decision making. So that's really what this is all about today. And I just want to remind our audiences, because as you know, there are other things going on that Gravity is involved in that are much more specifically focused on the relationship, for example, between human services and the healthcare delivery system in terms of moving information back and forth between them. So today's meeting, and I know Tim is going to do a wonderful job of facilitating this and moving it forward, is I hope the first of many to really get these use cases together. We feel that this initiative intersects with a lot of other work going on with federal agencies. The current rule that's been out there only a few days from Centers for Medicaid and Medicare, I think is quite important. How data is captured, how it's shared, and how we measure ultimately progress and hopefully success. Our center has, we believe, the organizational expertise, certainly the passion in this area, and hopefully the capabilities and history to foster multi-sector partnerships, both at the government level, but also at the state and local levels. And I know some of our other partners are on this call today as well. So I do want to just say thank you for being part of this work group. We are very excited about the opportunity and hope to develop some consensus around these use cases, supporting the electronic collection of this information, but really, as I noted, most importantly, the use and success of this data in helping us understand social determinants of health writ large in our communities so that we as government can hopefully decrease barriers and assist and support all of those groups in terms of improving the public health and hopefully health inequality. So with that, I guess I'm turning it over to Tim now. And I again, just want to welcome you.
We're so grateful for your time. Tim?
Yeah, thanks so much, Dr. Hacker. And I'll go ahead and give the background really quickly and then turn it back over to you guys. So I think the thing to say about where we are and why we're here, and to help you put some context around why this work is coming out of the National Center for Chronic Disease here at the CDC. This is a representation of the divisions that we work through within the National Center for Chronic Disease. And as you can see, it spans the entirety of the scope of activities that are associated with chronic disease, population health, et cetera. We're super excited to say that each one of these divisions has its own specific set of activities around disparities, around equity, and around social determinants. And so to come together as a center to do this work is super exciting, and we're happy to be working with EMI advisors on this. The next slide will show that our center, as a result of the internal strategy formulation around the response to social determinants, we conducted internally under Dr. Hacker's leadership some strategic planning activities and work group activities that help to identify these as the 5 critical areas that we needed to focus on at the start to try to demonstrate how CDC, in particular National Center for Chronic Disease, is helping to make change in this space around social determinants. And as you might imagine, in the next slide, will show that we can't get there unless there's an underlying data strategy to support that scientific and programmatic work at the top. We recognized then that we needed to begin to think about how we're going to arrive at a common understanding of what critical data elements were essential in helping to drive social determinants of health activity, specifically through the lens, as Dr. Hacker mentioned, from the public health and population health perspective. Secondly, Dr. Hacker talked about building consensus. We recognize that there are a lot of organizations, entities, entities, activities, and individuals, including many of you on this call, who are doing frontline work on social determinants and health equity, et cetera. The goal of this work that we're doing in partnership with EMI advisors is to help us identify opportunities to leverage this work as a harmonization or coalescing agent, if you will. And then finally, we recognize also that many of us are building systems, solutions, technology, applications, strategy, policies, et cetera. The hope, however, is that we can identify a common framework, a future state diagram that all of us can begin to point to and identify as some North Star-like point, if you will, into the future that we want to build toward. And hopefully this work that we're doing in partnership with EMI advisors, along with you all on this call, can help us to get there. I'm going to turn it over now to Dr. Kyla Davis, who will walk you through a couple of more slides from our team.
Can you hear me? Oh, there we go.
Yes,
So as
we can hear
Tim
you.
mentioned, thank you. So as Tim mentioned, so our center have been on the road of developing SDOH measurements, and these measurements are really going to get us to really help us think through of that data strategy that Tim mentioned. Next slide, please.
I think we lost Kyla's audio.
Oh,
I
there we
can
go.
pick up that slide. Oh, are you back? Okay, got it.
Yeah, you still can hear me? Okay, there we go. So sorry. So within our center, we have several SDOH initiatives, and these are just some examples. And these initiatives really focus on coordination and partnership, helping to advance data capability, data interoperability, and data capture, as well as community and clinical linkages. There are some projects that are cutting across all of these different categories, such as what we call CODI, which is our clinical and community data initiative. What they're really trying to do there is really trying to build the IT and data infrastructure to exchange data with health systems, with community-based organizations for public health use, as well as for research. We also are participating, as Dr. Carney mentioned, with the Gravity team on their technical advisory group. And then we also have some project that really focuses on advancing our standards. But we do realize, as Dr. Carney mentioned, that we really needed to take a step back and think through how can we get to that data strategy. And for us to really get to that data strategy, we really need to think through what data do we need, how can we get that data in a standardized manner, and how we can actually use that data in a meaningful way. So that gets us to our initiative, which the next slide is going to get to, the reason why we felt like we needed to do this initiative. Next slide, Gabrielle.
Actually, previous slide. You were on the right slide. That's right.
So yeah, there you go, Gabrielle. Thank you. So we felt like there were 5 different reasons why we needed to do this initiative. One, it really helps build out that public health case for getting that social determinants of health data. It will help us to articulate the pain point, and again, stressing the reason why we need that social determinants of health data for our public health activities. Secondly, it will really help us to accelerate the use of this data. It would help us to take the findings, and from the previous slide, you saw those different initiatives. So we could actually use that information to provide recommendations to further accelerate our use of that data. Third, it would really help increase our partner awareness within CDC, but then it would also help to harmonize and synergize across the different activities, the different CDC activities, as well as federal and other national SDOH activities. Fourth, it's actually a priority within CDC. It is a priority for our essential public health services, and it also aligns with our Healthy People 2030 and Public Health 3.0. I also want to mention as well that it is a priority within NCCDPHP. Some of you may have heard of our data modernization work that CDC is doing, and within NCCDPHP, one of our priorities around that is social determinants of health. And then fifth, it aligns and supports the federal health information technology priorities. So within the 2020 to 2025 federal HIT strategic plan, within that plan, there is a goal around social determinants of health, really focusing on that capture and exchange of social determinants of health data. Next slide, please. So with this initiative, we have started the work since last year, and we're really going to be taking a collaborative approach to getting to these recommendations and building these the business case. And to do that, we're going to have a three-pronged approach. One is that we have been doing a lot of environmental scan. So we have been gathering information. We have been doing foundational interviews and just looking at the different social determinants of health data and IT initiatives in the space of chronic, but also in the space of public health. And then we're also going to be convening a work group, which is this work group that we're kicking off. And we really want this work group to really help us drive to come up with the business case in a consensus-driven approach, to think through what are the different use cases, and really thinking what are the different organizations that are going to be a part of that use case, the data that should be a part of the use case, as well as the different transactions. And then lastly, we will take in all of this information to develop the recommendations. Next slide, please. So we're working on creating the recommendations by September 2022. And as I mentioned, we have been doing those formative that formative work starting back last year and early January. And so what we've been doing has really been focusing on that information gathering. And right now we're just launching the work group, and we're taking a lot of that information from the information gathering to think through for the next 8 weeks what this work group meetings are going to be about, so that you could help provide input on the information that we have created, as well as the use cases that we have identified, as well as some that input that you'll be giving. So once we've completed the work group, again, we'll be taking a step back, taking all of those findings, and we'll be disseminating that information through different mechanisms and different streams. Thank you.
Thank you, Kyla. I do apologize. It was a little bit of a lag. I hope that everyone was able to hear it. And as a friendly reminder, we will post the recording as well as the full deck on our Confluence site. And we would like to pause here to ask our audience if you have questions. Again, we welcome you to use the chat function. Please make sure you send the message to everyone, or if you'd like to address the group live, you can raise your hand and we'll be happy to unmute you or chat. So we'll give here a few minutes, a few seconds. Any questions on the background of the initiative? All right. Hearing none, I will move us right along. Yes. Yep, we'll certainly share the link. Is there a good link for a data modernization initiative? Lorraine, thank you for your question. Is there a good link for your data modernization initiative? If you're referring to this particular project, the link that I just dropped in the chat, that will be it. However, just wanted to clarify that there is, CDC is having a larger data modernization initiative on their end. And I do have one hand raised. Please, go ahead.
I can speak to that question. There is a public-facing site for data modernization. I will drop that in the link here. It has a lot of resources, descriptions, definitions, and it gives a summary of any past newsletters and other things essential to our DMI efforts. So I'll drop that in the link.
Thank you. Perdit has been very active in the background. He already did. Thank you so much. And I do have hand raise. Shay, I hope I pronounced that correctly.
Yes, you have. Thank you. And thank you to everyone for this really extremely important work. One of the things that is, I think we should keep in mind, or I would ask that we all keep in mind, is the unique data requirements and how we collect data on behalf of American Indians and Alaska Natives, the tribal communities. And they're very different, very unique. Sometimes the states do not require in their data collection, race or ethnicity. There's barriers and challenges then to get data back to tribes from their bordering towns, right, around their tribal lands. So I would ask us to keep that in mind as we go through all of these really important next steps. So I just wanted to put that out there and say thank you very kindly. Over.
We appreciate your comment. It's very well taken. Thank you so much. And I will go ahead and lower your hand now. Are there any other questions or comments? Wonderful. So I'll move us right along, and we will have pauses throughout the presentation because we do want to make this as interactive as we can. Great. Without further ado, we'll go ahead and do a work group orientation and give you insight into the scope. Evelyn, I want to make sure, yeah, you're on. Perfect. Great. Thank you.
Thank you so much, Gabby, and good afternoon, everyone. I'm delighted to provide the orientation around how we'll be managing and facilitating this work group moving forward. Just as Gabby had initially introduced me, I currently serve as the program director for the engagement with CDC, but I also serve as the senior advisor on the Gravity project, co-founded Gravity with Siren Social Interventions Research and Evaluation Network out of UCSF. Delighted to be able to build off the Gravity framework for this new work group. So if we move on to the next slide. So I want to start, of course, grounding us on the Gravity project framework to understand how we are going to be leveraging it to work on the public health focused use cases. So for those not familiar with the Gravity project, we developed this framework to illustrate how we would be developing data standards to support predominantly clinical activities. So Dr. Hacker did mention, the Gravity project has been centered from the start on social care integration, meaning how do we collect this data and use it within a health system, knowing that many of the interventions happen outside. So it was important for us as we looked at defining data concepts to think through of those overarching key activities. So when we talk about key activities, we talk about screening, administering the social risk questionnaire, and predominantly that could be administered via a patient's mobile app or person's mobile app, and then collected or added to their electronic health record, predominantly in clinical IT systems like EHRs. As we go through the process, you identify, what the health concerns are, come up with a diagnosis, and then you start shifting to working with the individual or the patient on setting goals. Again, many of these three activities of screening, diagnosis, goal setting, and initial interventions are documented within the electronic health record. And so when we look through this process, is we acknowledge then when we get to the intervention level, the actual closing or the acting on the intervention, most of the time happens outside of the health system. So this again is very individual, patient level. But our conceptual framework also acknowledges the use of this data. Again, very much highlighting what we've heard from the CDC team is there's an opportunity here is once it's captured one way in a standardized and structured way, it can be reused for other purposes. So when you look at the top left-hand side, we say, the importance of this is that the data can then be aggregated and used for downstream or upstream activities. And I'll go through what upstream, but upstream, again, acknowledging public health, but also for research, for population health, downstream activities for risk adjustment, risk stratification, quality reporting. So a lot of these things we say, the value of the aggregated data. So currently our Gravity framework is focused on that individual level data. And now we'll start looking at once it's aggregated, how can it be used for other areas? Next slide. So when I think about upstream, I'd love to use the public health parable. So many of us may have or may have not, so I'll go through the public health parable that teaches us about the three friends who reach the crest of a mountain and see specks of people struggling in the water. and they are being swept over the falls to their deaths. One of the three races to the river close to the falls, dives in and begins pulling the people to the shore. She keeps doing this over and over again, but she can't save everyone. Her second friend then sees boards, gas cans, and long poles of bit upstream by the side of the river. He constructs a raft, pulls into the river well above the falls, and saves batches at a time of people. But he too is overwhelmed. And resting by the river in between the missions, the two friends then spot the third friend swimming up the river away from the falls. They shout up to her, and she responds, "I'm going to find out who is throwing all these people in the river and try to stop them." So the first friend who jumps into the river or the water is the downstreamist. She represents our acute health system, the first responders, the hospitalists. The second friend with the raft is a midstreamist. He is our primary care system that treats non-acute and chronic conditions. The third friend swimming upstream is the public health professional, seeking to identify and resolve the conditions that keep pushing people into the water. She is our upstreamist. So all these three friends need information to better care and treat those people that keep falling in the water. Our current health system has invested heavily in creating a robust data infrastructure and technologies to help all three friends save people. However, the data is distinct for the needs of each of these friends. So again, tying into what we've heard today already, there's specific needs based on the care and delivery that's needed where these individuals are at. So as we talk about data interoperability across acute, primary care, and public health, basically around downstream work, midstream work, and upstream, we have a significant opportunity to better arm the upstreamists with more timely, more granular, and measured data leverage from the systems that are currently capturing this right now. So we talk about electronic health systems that are the ones within the downstream and midstream. They're capturing this data quickly. It's being documented, lots of data. And so it's important for the upstream to have access to these data sources to fill the gaps in current SDOH data assets that she needs to improve individuals and population health. Next slide. So I mentioned our gravity framework, and in the past, and say this is also what we do right now, we want to acknowledge the Gravity Project, we've made significant strides in establishing a foundation for representing and exchanging electronic SDOH data across and between health and community-based systems. So we talk about also within the data standards, we've come a long way since we initiated in May of 2019. There are data standards available right now to represent this data in electronic health records, and also standards available to exchange the data. Our current use cases are focused on that data, that clinical encounter. But the future, and why we're here today, is that we want to leverage our work to collect and use the aggregated data within EHRs to advance population and community-driven interventions. Next slide. So it brings us to the scope of this work group. Why are you all here today? So as a work group, you will develop an SDOH public health business case and high priority use cases for chronic disease prevention and health promotion. You will also design and publish up to 3 high priority public health focused use cases that extend beyond those already developed by the Gravity Project. Again, Gravity's focus, our current Fire IG, is clinical care. Here's the opportunity to advance and move into public health focus. Public health in the context of this initiative is defined as the science of protecting and improving the health of people and their communities. This work is achieved by promoting healthy lifestyles, researching disease and injury prevention, and detecting, preventing, and responding to infectious diseases. Again, bringing us back to the public health parable, right? This is identifying all the things that keep people from falling into the river and flowing over the falls. Next slide. So key definitions for those not familiar with what a business case or a use case is. So business case describes the value proposition For an initiative or an investment, the why. So we don't start anything, and even today, we won't even talk about data standards. We say anytime you're investing time on something or money, you talk about the why, right? So this is what we'll focus on first with all of you, the why for this work and the initiative goals, schedule, potential benefits, assumptions, risks, and return on investment. The use case is defined, describes the technical narratives of the interactions between the users or individuals and the systems they use to document, exchange, aggregate, and analyze electronic data. Use cases play a critical role in capacity building and standards development. So that's why we are doing this work under the Gravity framework as an HL7 fire accelerator, because we do want to inform future standards development. It also helps specify the key list of actions or transactions between a user or of a system and an electronic system to accomplish a goal. So again, acknowledging many of the data sources that public health professionals use are beyond just the electronic health record. There's a lot of aggregated data and registries. So part of this is also to acknowledge how can that information can also be tapped in, or data, we say data captured in a standardized and structured way can be reused for many purposes. Next slide. Also important is what out of scope for our work. And this is not to say that this can't be future activities, but to keep within our very short timeline for developing the use cases, we are not defining data exchange standards or data elements for race, ethnicity, sex, primary language, disability, and SOGI, as well as SDOH domains. The reason is the first bullet, SOGI data, there's a lot of activities right now within HL7 and the other federal agencies that are working on this. So we're not reinventing the wheel, we will just align to it. So lots of activities that are defining this currently. And SDOH domains are being defined to the Gravity terminology workstream. So that's why they're out of scope for this one. We will also not be creating use cases that do not directly support the public health data activities listed in the scope statement. And we will also not provide incentives for implementation of the use cases or develop any data sharing agreements and policies that promote public health and healthcare provider data exchange. Next slide. So our approach, we will build off the same approach used for Gravity that's open, transparent, and virtual, and promotes broad stakeholder engagement from any stakeholder, multidisciplinary, diverse stakeholder groups. All deliverables developed through this work group will be reviewed and finalized following nationally recognized standard development principles of openness and due process. And this very much ties to the same principles used by HL7 in developing their standards. It's one we've used for Gravity. It's ones we've used for our other work, working with the Office of the National Coordinator and CMS. So in that regard, then we invite all workgroup members to either join as a committed member or other interested party. So if we move on to the next slide, I'll explain what that means. So you can join us as a committed member, which means then you commit to regularly participate in the biweekly meetings and actively contribute to the development and review of the workgroup deliverables. You, as a committed member, you will be expected to vote on the deliverables we create, and we will call on you if you don't vote. But as an other interested party, you can still join, and you can follow the progress of the work group as observers and participate in discussions. You will still be able to submit comments on our workgroup deliverables, but you cannot cast a vote. So this is really we appreciate everybody has day jobs and they may not be able to follow this week by week. And so we still want to give you an opportunity to contribute. So please, if you've not done so already, sign up either as a committed member or other interested party. Next slide. So what does it mean to be a consensus-based project? So here by definition, consensus is a core value of the HL7 and other American National Standards Institutes, ANSI accredited organizations. Collaborative members will be given at least 1 week to vote on a workgroup deliverable and submit the relevant comments using a Survey Monkey. And Gabby will go through that in the coming slides. You can vote as a no, a formal objection, or yes with comments. and all of them will be resolved. So again, you have an opportunity to define what your key concerns are or provide comments. And again, as noted, only committed members can vote on deliverables. Next slide. We have a work group project charter. So this will be one where you don't have to vote on it, but I just want to acknowledge we did develop a project charter to guide our work. So again, for anyone just joining us for the first time, and it's very much all the slides we've gone through, giving you background on the initiative. We encourage you, if you have not done so already, to review it, and you will see what our overall objectives are for this project. Next slide. So really important, the ability for us to achieve consensus is following collaborative norms. So if many of you are joining us from the Gravity Project, you've done a tremendous job aligning to them. So here for new folks is just acknowledging what we mean by collaborative norms. We have to be respectful of each other. So this is really talking through about pausing, paraphrasing, posing questions, putting ideas on the table, providing data, paying attention to self and others, and presuming positive intention. So we welcome all comments, but again, being respectful. We use the chat features for that reason. And as Gabby noted, we have pauses in whenever we do have presentations. So again, for those that have participated in a Gravity meeting, you're familiar to this. For those not, we will follow the same process that has worked. And I know people have had some concerns about the number of people. I see 73 right now. We've been able to do this on the Gravity Project, having 200 to 300 people at a time. So it does work if people follow the norms. Next slide. Here, all our materials, we have a Confluence platform, so the link is there. Everything, again, following our open and transparent process. All materials will be posted and made available on the Confluence page. We do not take minutes because of the large number of attendees, but we record all meetings and make the materials available to you to peruse afterwards. Next slide. Okay, so I'm going to go through our workgroup schedule quickly. You will see this for every meeting to let you know where we're at. But again, given our very short time frame, it's really important for us to follow a clear and structured schedule to meet the project goals. So we will be convening you all for bi-weekly for 90-minute Zoom meetings. Each meeting will have a set agenda and we'll have set homework. This is really important for this project, is because we will be asking you to do things every time we meet and expect return to review that in the following meeting. So these are I won't go through each one week by week, but acknowledging we are in the first one. Our work group meeting for today, it's our kickoff. We're going through orientation and we'll introduce you to the business case, but you will have homework. So the first one, of course, is to join the initiative. Second is to read the charter, so get acquainted to the project charter. And then we will ask you, which Gabby will go through, to start commenting on the business case. And then when we convene again, May 4th, we will come back and review the comments you've submitted, right? So part of our process is you have an opportunity, a 2-week window, or 10 days, I believe it is. Gabby will go through it. You'll have a certain time frame to review and provide comments. Then we'll come back, consolidate them, and present them back to you with our thoughts and get additional comments. And then at the next meeting, Gabby will walk through how you can submit a vote. So you'll see that you'll have different activities. So you'll get your first chance of voting at the next meeting, and then we will finalize in the meeting afterwards. Next slide. So I think just in the interest of time, I won't go through, is just knowing that, yep. So we conclude on July 27th. So you will have 2 deliverables. Again, you will vote on the business case, and then you will vote on the use cases. But you'll get a chance through all the time, because the use cases, we assume to have at least 3 or 4 use cases for you to review. So you'll have an opportunity each time we meet to provide comment on it, and then we'll publish it for voting. Next slide. Okay, so that was a lot. Let's pause now for questions.
Thank you, Evelyn. I do see a question in the chat that is directed to Dr. Karen Hacker. And just want to ensure if Dr. Hacker is on the line. From Shay, has CDC brought this to the attention of the Tribal Advisory Committee for consultation and potential membership? We'll be happy to extend an invite. Just kind of speaking right from our admin team here, but Tim, feel free to jump in.
So I just wanted to,
Thanks so much. Go ahead, Dr. Hacker. I didn't know you.
I just wanted to say that we actually did present to the Tribal Council around social determinants. In fact, they gave us a lot of feedback. I thought I saw that there were a number of tribal members who had joined this call. We can certainly put the invitation out to them as well and through the Tribal Council.
Dr. Hacker,
Fantastic. And I was just going to go ahead for your follow-up.
yeah, Dr. Hacker, can you hear me?
Yes.
Thanks. Yes, I listened to the presentation to the TAC. I'm just thinking about we can formally, since they were so enthusiastic, I mean, truly, they were very much engaged, as you indicated, that we have tribal epicenters, right? And I think that this might be an excellent way for SMEs in Indian country to be engaged based upon exactly what you said. And it's, of course, the tribal epicenters are also partially funded, not only by CDC, Dr. Montero through CSTIL, TOTASA, but also Indian Health Service. So, I mean, we can talk offline, but I was just hoping that we could see how we could get the tribal epicenters, because this is exactly what they're so enthusiastic about. Thanks, Dr. Hacker. Appreciate you.
Or a great suggestion, and we'll definitely follow up.
Yes. Wonderful. Thank you so much. And we commend everyone that, would like to ask a question live. We welcome your engagement.
I see Jim has made a comment that he applauds the effort, but an offer we have to also consider the SDOH processes and either new or existing data standards for those processes and CBOs, welfare agencies where FHIR and USCDI is not native. Absolutely, Jim. And you don't hear us talk about FHIR and USCDI here because we really want to get to the use cases being agnostic of the standards used. It's really around that value of why would public health professionals and agencies want to use the data, right? So thinking through, but acknowledging many of them are not using FHIR-based are using, health or any systems that use FHIR standards or aligned to USCDI. But we know that will be a starting point. So again, we do acknowledge we're not going a deep dive into the standards here. It's really around the data transactions needed, knowing that there'll be different modes of exchanging that data.
Thank you. I do see also a question from in the chat from Lolita. Can you briefly discuss the sources of the use cases studies? So I think we want to clarify there that we are focusing on the use case and not studies. Evelyn, would you like to chime in?
Yeah, so actually the team will go forward in the coming slides. We've had a series of interviews to inform the use cases. So we'll have initial use cases we'll present in a story based on what we've learned from our information gathering activities that Kayla walked through initially, as part of our process. But it's not, again, there's some literature that there's a very robust environmental scan the team did. So we can share that if needed. We haven't presented back. It was something to help ground us to start this initiative. So we have that information. But what we do is we'll put something again back, put it all for you to review and comment on, and that's part of our process.
Wonderful.
And
Okay.
Sheila, do you want to? Sorry, I just want to make. Sheila's our use case lead. Does she want to add anything?
Nope, I think you summarized it well. Thanks, Evelyn.
All right.
Okay. So just keeping us. Thank you, Evelyn, for the kind orientation as well as our management structure for the work group. We will be moving into our next section, giving you all a little more insights into the data infrastructure gap analysis and interview findings. Kate, I'd like to ensure that your audio is on.
Yep.
Perfect.
Can you hear me okay?
Yes, we can.
Great, fantastic. Thank you so much, Gabby, and thanks, Evelyn and Dr. Carney and Dr. Hacker. It's great to launch this work group, and thanks everyone for joining. Next slide, please. The next handful of slides is just going to be an overview of what we've done for some background information, as Evelyn said, to ground ourselves in where are the data and infrastructure capabilities right now, and where are some potential gaps or some opportunities for different alignment. So the objectives for the gap analysis included analyzing the prioritized CDC data set elements and infrastructure to inform the use case. We've also wanted to document the different social determinants of health domains from CDC to the Gravity Project. We also identified and collected and validated information with multiple stakeholder interviews within the CDC divisions across agencies, as well as some listening sessions with the external partners. We also wanted the objectives of this will inform the Gravity Project effort, but it also will inform CDC and other federal agencies on alignment gaps and technical readiness. Next slide, please. So through the process, we started with an environmental scan where we identified industry and CDC priority areas. We looked at different initiatives, policies, programs, as well as data sets, data sources, and different initiatives. But we were able to do a point-in-time environmental scan of all of the priority activities that were happening, and of which many folks are probably a part of a lot of those. There's a lot of activities happening at the community, state, national, and at the federal level. We did the data scan where we analyzed the CDC data sets, and they were prioritized by the NCCDPHP team, and we started to look through that, which we'll go into a little in just a moment, but also the partner interviews. And we spoke to some of those. We did 23 division interviews, plus also partner agency interviews, as well as 4 listening sessions with our external partners. Next slide, please. So some of the things around this is we wanted to make sure that we were aligning the data sets, and we also wanted to evaluate whether the EHR data could supplement the different opportunities for chronic disease SDOH data needs. We also examined and collected different SDOH data for CDH, examined what is currently being collected around social determinants of health data for different CDC and public health uses. So when we looked at the CDC data sets, we looked at the sources, we looked at the level of data, whether it's individual, population level, census, zip code, county, state, national. We also looked at whether different standards were used, uses, what were the primary users, and how often was it updated, and at what frequency. We also looked at the reporting infrastructure and what are some of the technical tools and infrastructure available to help support that data access and use. And then we also looked at the different domains to ensure that where there was alignment and where there was potential opportunities for further alignment. Next slide, please. So this is just a glimpse. It's an at a glance. I know it's difficult to see, but these the data scan will be available as a tool within Confluence, and it will also to help support and inform the work group. But it also helps inform the business needs, the business case, and will also be a tool to support the work group, the use case work group development. So these are a handful of the prioritized CDC data sets with acronyms. The orange are the CDC SDOH domains, and then the greens are the Gravity Project domains for codes and terminology that the Gravity Project has been working to develop and standardize. We went through the different data sets, looking at the different data survey questions, data questions, and identified where there were some ways that they were aligning up, were very clear alignment, and some were actually a little close, but not exactly. And then what we also did is we kind of backtracked and said, okay, if there's a Gravity Project alignment, a standard domain here, how can we map it back and ensure that it met the SDOH domains that CDC has identified as a priority. Next slide, please. So this is just a table that describes what I just went through, but the CDC NCCDPHP domain is on the left. Those are built environments, community and clinical linkages, food and nutrition security, social connectedness, and tobacco-free policies. Second column goes through the definitions of those particular domains. And then what we did, the Gravity Project domains, which are available on the Gravity Project Confluence site, we identify the different codes and terminology that Gravity Project has standardized, and we line them up as to discuss and to see how they were mapping up to support the CDC domains as well. To point out, the community and clinical linkages is interesting because I think there's an opportunity for discussion that was going to come up in the work group around this. There's a lot of different ways that I think we can all get on the same page and come to an agreement about, because I think there's a lot of those domains that could fit that that domain, but I think it's going to be one of the discussion points. Food insecurity fits to the food security domain. That's an obvious connection point. There are a handful that are not assigned. Some of those are just because they didn't quite match up, but there might be an opportunity from some of the partner and the work group feedback that maybe they can actually support some of the public health SDOH data needs. So some of those are around elder abuse, health literacy, financial insecurity, material hardship. And they just didn't have a perfect correlation to some of the different survey questions and measures that and activities that were happening. Next slide, please. So this is very high level on the gap analysis summary. What I'm going to walk through is just some of the findings from it, and a summary of those findings, and then some opportunities that are available with this work group and what might come out with a work group use case. So there's multiple data capture methods. Data are captured through different mechanisms, but there's not a lot of standardization of the data type or data format. So some of those data capture methods are surveys, some are different measures, but there is an opportunity around identifying where EHR structured data can be captured and shared for public health uses. There's multiple systems that are reused as key data sets, and that's at the national level, but also down to the state and the local public health and community levels. And reusing those data sets is great for informing surveillance, epidemiology, program evaluation activities, but there's the survey data that's combined with the other data sets can often be specific to different program needs. And there's opportunities around maintaining lists of these data sets and domains and opportunities for reuse and integrated data. There's also the inconsistency around data sources. And EHR data is not always a typical data source for some of these national and state and community level population health indicators. I think there's an opportunity to identify where that data is, where it's standardized and structured, where it can be either extracted or reported to public health so they can have access to that timely structured data. And there's also opportunity around the survey question alignment. There's a lot of the survey questions that are not aligned, but maybe asking around the SDOH domain. And CDC does have some different work groups, so they're working on that. Other related findings came from the interviews, including the data timeliness. A lot of the data sources were often 2 years old. And so there's an opportunity there to identify what community and program partner data sources might actually have some more available, timely, structured data to meet these data needs. There's also a need for coordination, data and coordination to ensure there's alignment across the different data and measure identification and alignment. And there's a lot of cooperative work groups at CDC around those. And finally, there's also the data capture and availability. There's a lot of the methods for capturing the SDOH data in clinical or community setting workflows that might be available to support public health uses. And that's where I think this group can help identify those key areas on what is feasible, what is reliable, and what is possible for it to enable access to that electronic data. Next slide, please. So the overarching key themes that came from the scans was that the SDOH language can vary. Everyone talks about the same, are talking about similar things, but sometimes they use different definitions. So within the data scan, we did align up the Gravity Project definitions as well as the CDC definitions. And one example is just around financial security versus a lot of the surveys at the national level were coming up with under the federal poverty level. Not quite the same thing, talks to financial insecurity, but not exactly asking it the same way. The visual on the right just shows that some people might call the color blue, while some people might call it aqua. Technically, they're probably talking about very similar things, but sometimes the terminologies are just a little bit different. There's also a need for, just as a key theme, is that there's a lot of areas that are focusing around interventions for individual or family needs versus what is happening at the community level. And it's going to be important with this group on all your great minds and experience to help kind of, tease that out a little bit and make sure that folks know what the data is used for and how it could benefit the community interventions at the population level. It's also an opportunity for data reciprocity. So identifying and understanding the value and authority to share the data among public health, but also if you report it in or share it with public health, what is the opportunity to get information back to also inform different organizational community activities. And finally, there's the data needs and use. There are multiple divergent uses of data at the local, state, and national levels, but the key for this use case that Sheetha will go over in just a moment is going into more of the how do you get access to that more individual, timely SDOH data to help inform the broader public health uses. Next slide, please. All right, I'll stop there and turn it over to Gabby in case anybody has any questions or anything to clarify.
Thank you so much. That was an amazing overview of all the work behind the scenes that prepare us for this work group launch. I don't see any questions in the chat just yet, but we know it's a lot of information to digest. Friendly reminder: we will be the recording will be posted on our Confluence site as well as a slide deck for your own reference and review. We'll give people a few more seconds to maybe digest it and see if you have questions for Kate on the data infrastructure gap analysis summary and key findings. Also encouraged to raise your hand if you would like to announce your comments or questions live.
Kate, this is Tim. It might be really helpful if you could share a little bit about how in the course of the environmental scan, we're taking into account the activities within certain agencies across the board. How do you envision elevating all of that work that's happening within these respective agencies to a level of a consensus public health use case?
Yeah, absolutely. It was really fascinating to try to raise all of that and identify and cover all that, but also bring it all into a centralized place to have a list of, are you aware of the activities that are happening within the divisions, across the centers, but also across federal agencies. And we were able to aggregate a list of all the initiatives to make sure that folks were connecting the dots and the right folks were talking to the right people and having the right programs are also might be advocating for use of data standards and collecting electronic SDOH data and how those could potentially align up. I think that there's always that awareness that needs to happen, and a lot of these activities can happen in silos, but starting to uncover those and document those and have those for awareness is going to be useful for this work group, but also for the broader SDOH needs. Evelyn or Sheetal, anything else to add on Tim's question?
I think that's great. Thank you, Kate.
I do have a participant that chatted in a question, but also raised their hand. Himali, if you don't mind, feel free to ask your question live, and then I'll move on to the chat.
Thanks, Gabby. Hi, Kate. Your presentation and work is really impressive, and I specifically like the slide where you have compared the CDC data sets for CDC use and all the domains that we have covered in Gravity. So I have my notes ready, and anything that you have listed as a CDC data set that is covered in CDC, but not covered in Gravity, I have made a note of it. I will definitely take this list to the internal Gravity team and see if we can get any additional information from it to be included in our domains. Thank
Wonderful.
you.
Absolutely.
Great, thank you. So the question in the chat reads, will advances in data science / data processing technology also be addressed, because some of the key challenges just articulated may be addressed with technology in the near future? Any thoughts?
Yeah, I think that there's a definitely an opportunity to understand what are what's the capacity and capabilities to access the data. And I think that as different standards are emerging and the technology builds its capacity to in order to support those are something that we're always keeping tabs on and ensuring how it's lined up. It's not just data elements and data standards, but also how to transport and access and query it and do it on a population level. And I'll also tag it, Evelyn, to add on to this too, is that this group is very tapped into a lot of the different efforts that come to some of those emerging standards and emerging technical capabilities. So we want to ensure that we're not developing the use case in a divergent way, and that there's a coordinated opportunity to share the information across and make sure that it's in sync with the industry and what's developing. Evelyn?
No, thank you, Kate. I was just going to add to when we think of use cases, it's also another way to frame them as requirements, right? Functional and technical requirements. So you think of, if there's a problem, the use case is really, there's a problem to solve, and this is what we need, right? These are capabilities we need in a technology, right? And here's a possible workflow. And part of it is sometimes, just like anyone has, I want you to build something for me, but I can't tell you what it is. I can only tell you what it needs to support. So think of the use cases in that way. And then for us, we're not going to say, what exists out in the market to support it, but they could be used as something to, we talk about even with Gravity is like, how can it spur innovation, right? How, as you think through what is actually needed to solve a problem, then think through, well, what are current solutions that can support it right now, or what else can be created to address the need, Does that make sense, Sarah? Okay.
Wonderful. Yes, thank you. Thanks, Sarah, for the question and comment. So without hearing none, I think we can move ahead. And again, we do have some pauses to continue to engage with all of you today. So we are shifting gears towards our last section of the day, an overview of the SDOH, Social Determinants of Health, Public Health Business Case Overview. And I would like to invite Sheetal to the virtual mic.
Great, thank you, Gabby. And hi all, so great to join you this afternoon. If we go to the next slide. So the business case provides the justification for undertaking an initiative, as Evelyn mentioned earlier in the call. And so this document, which is about 10 pages, it outlines the why, the what, and the how of this project. And we thought it would be helpful as we kick off this work group and we begin to collaborate together to help align us on the purpose of this work. And so on this slide, you can see some of the sections that the business case includes, providing all of us with some background, the benefits, the risks, the anticipated return on investment and cost benefits. It also outlines the priorities and goals of Healthy People 2030, NCCDPHP's SDOH priorities, as well as the Gravity projects. And it also reflects the challenges and opportunities we heard during our various interviews. And so we'd be really grateful for your review and any additional feedback you have on this document. And then Gabby, I'll quickly turn it over to you so you can show us how we can find the business case and then submit the feedback and comments, which will take time to review together during our next meeting.
Absolutely. Yes. Thank you so much, Sheetal. And before I do the walkover, I would like to share the link in the chat of where to access it. So bear with me here. We're gonna go into another window in order to provide, to collect systematically feedback from the work group. We do have some instructions for everyone to support, the feedback required to really help us not only hear your comments, but also challenges, opportunities that can align us all together. So the first step is really to review the proposed use case document business case document. Provide comments. You are welcome to provide comments per section via SurveyMonkey. We are opening the survey. It's live now, starting today until May 2nd. We will close it at 12 noon to allow us time to review and consolidate the feedback received for our next meeting on Wednesday, May 4th, where we will review all of the comments. So over this link, and we'll share that in the chat in just a second, it will open up to something like this. Right now I'm in preview, so it looks a little bit different, but we are providing with all of you a description of the business case. Again, this is the why of the initiative, a recap of the instructions, and if you have questions or any technical issues, we are very happy to support you. You can just send us an email and we'll be happy to help you out. From there, we will kindly ask you to complete your information. I'm just doing a test run so you're able to see what it looks like. Again, name, organization, if you don't mind selecting your state, and then email. This will allow us to track where the comment is coming from. From there, you will be sent to the actual comment section. So again, you're able to provide input by section. You can comment on one or more sections as listed below. Here is a direct link to the use case via Confluence. So when you click there, the document shows up. You can download it. And you're able to have it on your computer to further review. We have our information in terms of the version, and then the different sections that Sheetal just mentioned are listed here. So you can be able to review it thoroughly. And then from there, as mentioned, we want to hear from you. Are we capturing, the right intent? We want to, of course, be broad enough because public health is broad enough. So we do want to, highlight that. And please, any wording or any, initiatives that we might want to highlight a little more, we welcome your input here. And then our last comment, it's really meant to be, if you want to share any other questions that you may have for the work group, we welcome you. None of them are required. We really encourage you to comment as much as you can. And we really want to thank you for your participation in this process. Once you are done with your comments, you will click done, and that will be the completion of the survey. So I'm going back here to our slide. And again, our goal is to provide consolidated feedback by our next work group meeting. And really, we're not highlighting or, not shouting anyone out. It's really collective feedback that we'll be reporting back. And we'll pause here for questions and see if there are any comments in the chat. I don't see any at the moment. But yeah, give you all a few minutes to process. And let us know if there's any issues with the links, any technical difficulties. We're happy to support you. Yes, absolutely. I will go ahead and do that. Share the link via the chat. Oh, I'm sorry, copy the wrong one. There we go. Wonderful. Any comments, questions? All right. So we do have about 15 minutes left to provide recap, next steps, and ensure that any questions did not get addressed during our time today, we can come back to them. Yes, I do have a question in the chat. Where will the slide deck be posted? Yes, so via our Confluence link, I'll post it right now. There's one page, and maybe I should actually demo it just to ensure that you have access to it. So this is our Confluence page, the link that I just shared. So feel free to bookmark it. You can also, if you have an HL7 account, you're able to watch the page. So anytime that a new document gets posted, you'll receive an automatic alert via email. But here is where to sign up for the work group as an official member. And towards the middle of the page, you get to see our work group schedule, as well as the pre-meeting, the homework, the documents, materials. So we'll be posting today's slide deck as well as recording in this section. Great. Any other questions? I see Lorita raise her hand. Feel free to unmute yourself.
Yes, I'm sorry if I missed this, or there was a lot I was trying to keep track of. Did you discuss the UASPI, is it 3.0 and the SDOH items that are covered there, or those that are being considered for the next update? Or would that actually intersect with this project? I'm just curious.
Great question. If it's okay, I'll ask Kate to chime in. Or Evelyn?
For Evelyn, yeah.
Oh, yes. So we're not talking about USCDI as part of this work. So the USCDI discussions are happening within the Gravity project. This work group will focus on the use cases.
Thank you.
Mhm.
Great. Any other questions, comments? Right, so I'll start doing a bit of a recap. A lot of our material covered this afternoon. So as homework, we are grateful for your participation and engagement, and encourage you to sign up as an official member via Confluence at your earliest convenience. You have two options there. You can sign up as a committed member, which provide you with voting privileges to support the deliverables mentioned, which is the business case and the use cases. And then interested party is if you want to stay at bay and inform, but you may not have the bandwidth or the capacity to vote, comment. That's another way of staying engaged. You are able to, as an interested party, just to highlight there, comment on the business case. You're just not able to vote on it as an interested party. If you would like to update your membership status, myself and Savannah will be more than happy to help you. That's something that we can do, in the back end. So there's no action on your end besides letting us know that you would like to update your status. And then we also would like you to please review and familiarize yourself with the project charter. Ideally by next Wednesday, just giving people a little breathing room between our sessions. But if you don't mind getting yourself familiar with that document, and then highlighting the homework related to the public health business case, to please submit your input by Monday, May 2nd by 12 p.m. Eastern time. And the Survey Monkey was shared via the chat. We will send a reminder email to ensure that you stay at bay with communication. And again, you can comment by section and or as a group. We'll pause here and see if there are questions. All right. And as closing remarks, again, please visit our Confluence site for the work group. For any other question and information, you can contact myself, Savannah Mueller as well, and Kyla Davis is our CDC point of contact. And we want to ensure that we left some room for questions from your end. We hope that this orientation, background orientation, and information on how we are approaching the work was helpful and valuable. We'd love to hear any thoughts. One of the suggestions that I heard or really will be helpful, as our work group is large, if you don't mind, in our next meeting, putting your organization name next to your Zoom name. That will be great also to identify, get to know each other a little bit better. But again, we welcome you to chat in, use reactions. We want to make this as interactive as possible. Thank you. I see some of you definitely got the hang of reactions, which is great. All right, any comments? Thank you all for your participation. We really appreciate. We know that time is a big commodity nowadays, so we are extremely grateful for your support. And we'd like to thank you for really supporting the consensus building process and helping us move the work along. We'll stay in and see if anyone would like to chime in, but this will conclude today's work group kickoff meeting. Thank you all.
Thanks, Gabby.
Thanks, Gabby.
Thank you, Gabby. Thank you, everyone. Thank you.
Yeah.
Bye-bye.
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 Thank you all.